convene as the Water Quality District Board. Item number 1 on the Water Quality District Board is to approve the October 19 minutes. So we'd be looking for a motion to approve once we've taken a look.
Once we're done, I'll make the motion to approve some, but we'll wait and see what other people say.
I don't have anything.
All right.
I'll second.
Okay. We've got a motion on the floor to approve the minutes. Any public comments on the motion? Any board or staff comments or discussion on the minutes or the motion? All in favor say aye.
Aye.
So moved. All right, item number 2 is public comments on items not on the agenda. Seeing none, we're going to move straight to board and staff comments on items not on the agenda. We're not going to get a water quality advisory council update this meeting. So board and staff comments on items not on the agenda.
I'd like to say congratulations to the county and your settlement out west of town. That's great news to move that property forward.
Yeah.
Yep, they actually, Anna's not here, but the court had to approve the settlement, and they did yesterday, so we should be getting money in a week.
Just so about how many cents on the dollar do you end up
89 cents on the dollar we got.
That's great.
That's pretty.
So the only thing we waived was a portion of the penalty.
Uh-huh. Oh, really? So
Which
you
there
got all
was-
the taxes, just
Got all the taxes, just not all the penalty.
That's
Yes.
it.
Yeah,
Then it's not a bad precedent to set. You gotta pay all your damn taxes.
yeah.
And the only reason we could waive it is because it was in court, so a court could say we could waive that piece, otherwise you can't. I mean,
Right.
if you owe me $1.10 and give me $1, and I'm the treasurer, I can't take it.
Yeah.
So, yeah, so, and all the taxing jurisdictions were excited about that. You know, of course, the 2 big ones would be the Frenchtown School and the Frenchtown Fire, and
Right.
the county.
Great.
So, yeah, it was a success, and so now, the other piece of it is that he has to, so the person who paid the taxes doesn't own it. He's the one who loaned them the money, so he's the financer. So part of the settlement is he also now has to foreclose on them before March, and March is when his penalty payment is due. So while that all happens, hopefully, there's somebody lined up wants to buy it, so we'll see how it goes, and hopefully we'll have it back in production with jobs and cleanup and all that stuff too.
Any other board or staff comments on items not on the agenda? All right, seeing none, we'll adjourn as the Water Quality District Board, and we will, I'm debating whether or not we want to jump ahead, just to get all the make sure we're done with all the action items early, so Deb can get on the road. I'm wondering if we want to jump ahead to the Air Pollution Control Board, but I suppose we have to wait for Burton, don't we?
Yeah.
Okay, so never
I
mind that.
think we'll have plenty of time.
We'll,
Seems pretty simple.
We'll go ahead and convene as the Board of Health. Item number 1, qualitative feedback from the regulated community and next steps. Shannon's going to guide us through that.
Hi, thank you. Yes, so I am going to, does that say presentation? Maybe? Does that say from beginning?
Yeah,
Pardon?
yep, this is.
Does that say
No,
presentation?
they actually
Hey,
said.
go down
You
here.
want a slideshow. You want to go to slideshow
Oh, slideshow.
first and then from beginning.
Yeah, that's what I was trying, sorry, there we go.
It is so big.
I can't see back there.
Yeah,
Back here, I can't see over there from back here. So, yes, I get to talk to you today about some fun and interesting stuff that we are doing in terms of getting some public feedback, and specifically from the regulated community. So, you know, customer satisfaction surveys are kind of a weird concept when you think about a regulatory agency, because we think about, not everybody's satisfied when they leave. Not everybody gets what they came in for. Not everybody gets to develop the property the way that they wanted to, because, you know, it's in the floodplain, or we can't issue the permit, or they have to go through process before they can get the permit, or we're interacting with them in a compliance way. You know, to tell them that they have to clean up the property, or they have to stop or start doing something. So customer satisfaction just always feels like the wrong words, but there is a lot, of course, that we can learn from talking with the regulated community, because sometimes we do things because we think that that's the best way to do it, but then we find out that that is wrong, and we can change a process without at all changing our goals. And so that's one reason, of course, to get public feedback. But we also can get, in the kind of essence of a customer satisfaction, we can look at, is our staff conveying information in a professional way, in a clear way? Are they being respectful? Are they giving the reasons behind the regulation? So there are those customer service aspects that we can ask about and get at. And so, you know, accreditation has brought us a lot of things and a lot of ways to improve. And one of those was that there actually is a big focus, and you probably remember this, but there's a big focus on getting information from your community, from those that you interact with, in order to improve your program. And so in the spirit of that, back in 2015, actually late 2014, we recognized that we really weren't doing that in environmental health. I couldn't really think of a way except when people came to you to talk about regulations, or, you know, that we talked to people beforehand about regulations, that we were asking for input. And so we started by asking our certified septic installers some questions. And we did this, frankly, it was an easy way to do it, because every year we sent them an exam that they had to send back to us. And so it was kind of an easy way to get a pretty good response rate, right? And Jim Irvin, who's the wastewater lead, said he suggested, and we went along with it because it was a great suggestion, and that was to make it a question on the renewal test, and give it points. And so you can't get a wrong answer, but you could lose points by not answering it. And it was also the very first question that we asked. And so the first year we asked a very general question. Hey, are there things that you think that you can think of that well, I guess I have the question more here, but it's like how can we improve what's working and what's not? It wasn't the exact question, but that was the gist of it. And we got really very positive responses, actually way more positive than we expected. When we looked at the number of responses, very few had a negative comment. Almost half had suggestions for us. And then more than half had positive things to say about staff and our it was specific, of course, to the land group, but to that group. And so the next year, we wanted to ask a more specific question, and so we focused on the strategic plan and basically asked them to help us figure out how we can get information to homeowners in a better way for about maintenance of their septic systems, and really focused on that it's a partnership between us and the installers there. And they answered in kind. And then in 2017, maybe this got a little, I don't know, too broad or too academic, or but far fewer people answered the question, even though it was worth points in 2017. But we were asking how could we basically assist them in doing their jobs? You know, how could we assist them in getting information to them? I don't think we were maybe the best at phrasing the question, but one of the answers actually was, please stop bothering us with these questions. And you know, I'm going to talk about our work with the University of Montana in just a moment, and one of the things is that you can get survey fatigue. Yeah. And so this year what we decided, in response to that feedback, is that we're going to give them the option to give us feedback if they want, but not make it part of the exam this time around. So, and we're going to try to change up the exam a little bit. So we actually did quite a few things in response to getting that information, which I could talk about for half an hour, but I won't, because I'm trying to get to the slide after this one. So the other thing that we did is, and accreditation is kind of guiding us on this path too, is that we recognized that in our review of sanitation and subdivision projects, none of them were getting through the first time around. So we were issuing what we call denial letters. They're deficiency letters. They're saying you have to give us more information before we can approve your project. And So we picked that as a project, and we did some data gathering, which I would love to talk about. Maybe Gina has with this group, I don't remember, but.
No, we haven't.
Oh, we haven't? Yeah,
No,
it's super
very rich.
interesting.
Yeah.
Yeah, there's a lot of information there. But part of what we did was a consultant survey, and Gina read some books on some surveys and put together the survey and tried to use best practices, and we got a lot of information back. Not all of it was information that we loved, because some of it was like, you know, some of it we had to come to terms with, you know. For instance, one of the questions that we asked was, what is particularly difficult for you about putting together an application? And one of it was, we don't know what you want, staff is inconsistent, it all depends on the reviewer. These are all things that we work really hard and have steps in place to not have happen, but that was their feeling of what was happening, or their personal experience, you know, of what was happening. So we put some things in place. Immediately, even though we weren't through with the QI project, to try to address some of the answers that we got on the survey. But we also asked, hey, what do you think could improve the process? And 4 main things came up with, what do you think you could improve the process? And those were pre-application meetings, more informal communication, bring back a specific exemption that we wanted to come back to. It's called the municipal facilities exemption, and then provide some training materials for staff, especially, or for the engineers, especially those new ones that are coming on, because there's always new consultants that are coming around. Well, the legislative session really did deal with 3 out of the 4 of those. So we have pre-application meetings now because it was in House Bill 507. And 507 at least addressed the more informal, there's not a directive to do it, but it opened up the process a little bit to make that easier for more informal communication before you go right to a denial. There are definitely pros and cons on that. I could talk about that for a long time too, because in a different legislative session, they would be harping is a bad word, they would be focused on a different aspect that leads to. But the one thing that we really could focus on, oh, and the MFE came back because Representative Hertz sponsored that through the legislature. And so 3 of the 4 things that they had suggested in our survey actually have come to pass, not because of our project, but and so we really focused then on looking at ways that we can provide materials that in an ongoing way and not just like on the internet. So we're working on that, and we will bring that to you at some point. It's going to be very exciting and fun. There's so much more about the QI project, but I'm gonna let that go for right now, though we'd be happy to talk about it in more detail if you are interested at some point. Because really, I wanted to let you know that we were doing things and we had started things, and I'm glad we did, because then we had a little bit of experience when we got to this. This project with the University of Montana came about because the commissioners asked that we look into getting more qualitative feedback from the community in the realm of what I'll call land services, but in septic permitting and well permitting and subdivision, sanitation and subdivision review. And so we had another part of accreditation is that we worked on improving our skills and had a recent fantastic training by Dr. Carrie Harris from the university on focus group and getting community feedback. And so Ellen put those 2 things together and said, let's work with Dr. Harris. And Claire Adams is a PhD candidate for public health PhD. And so we have a small contract with them to work with us for a year to learn ways about how to get public input using different things.
Yes. Just add one, I think, important twist to that.
Oh, yeah.
Carrie talks a lot about, you know, the power dynamic that you have when you're the regulator and they're the applicant, and how to acknowledge that and find ways to not, I don't want to say work around it, she would say it better.
Yeah.
And there's always some relationship between the person surveying and the person responding, but the power dynamic causes things to happen that may not give you the accurate information that you really need. So I think she's especially good on that particular tricky part of this.
Yeah, and there's some things that I just thought were common sense that she has turned on its head. So it's been very helpful
Oh, yeah,
for her to help guide us on this. And so in order to start this, we were trying to find, what question is it that we're answering? We know we want feedback. We know we want to improve our program when we can and how we can. But how, what should we start with? And we fumbled around for, I'd say, a good month or so. And then what we did is we looked at who we interact with and in what capacity, and then broke that down into who we wanted to get information with. And so we ended up with 3 phases of the project. And for the first phase, we did a desk survey. So from the end of July, a few days before the end of July, through the month of August, we surveyed everybody who came in to our land sanitarian desk. There's a sanitarian that's available 8 to 5 on most days, minus lunch, who will answer questions that come in email or phone, or somebody who walks in from the public. And one of the things that we asked them, basically how this was set up, is that they would have their discussion with the land sanitarian, and then the land sanitarian asked everybody, whether they were angry or not, whether they were disappointed or not, that we would love for them to take the survey. And then the survey was set aside. There were 2 ways to take it. You could do it on computer or on your smartphone. And on your smartphone, you just had to click, I don't know what they're called, they're boxes.
The QR code or whatever.
QRPs.
It reads, yeah,
QPR. Yeah, it's got a Q in it, and it's a box. And so, actually, nobody took us up on that particular method, which really disappointed Carrie, because she was super excited about that. But people did go over and take it at the desk, and we had, did I write down how many people? We had a good amount of people, and I'd say we had about 54%, I think 65 people out of 135, those numbers aren't exact, but took the test and, took the survey after they talked with the land sanitarian, and it was about a 54% response rate. Some of that it probably was even higher than that, because some people came in multiple times and they weren't going to take the test if they, I keep saying test, I'm sorry. They weren't going to take the survey, and we actually didn't want them to take the survey more than once. But I think that they got counted, at least they got counted at some point. So, but that was an acceptable response rate. It was over 50%, and so Carrie and Dr. Harris and Claire were happy with that. And then we didn't ask people for any personal information, male or female or what age group or any of that, but we did ask them, why did you come in today? And then to identify themselves as in certain categories or others, so property owners or consultants or installers. And the most common answers were that people were coming in for septic or well permit questions, and even to add to that 59%, there was another category that people sometimes listed, which was to ask about installing a septic system. So a lot of it was about septic and well permit questions. And then the most common answer was property owners, for the people who were identifying where they were coming from. And so what we wanted to do with this survey specifically, and it was different for us, it was really more customer satisfaction than we're used to asking, so it was different and exciting. But we wanted to assess what people's expectations were when they were coming in, and what their experience was after they were done. And so for this first question, well, I guess it wasn't the first question, but this particular question, we asked them how helpful they expected staff to be before they came into the department. And this was higher than we expected, but 48% expected us to be extremely helpful. So you can see what the categories were: extremely, very, moderately, slightly, or not at all. And it's interesting.
Yeah, that's, what's
There should be
200?
one more. The 4.84, I guess it didn't show up, was that they had no expectations.
Yeah, it's there. It's right.
No,
up.
but there's no classification.
There's no,
for it.
yeah, it's not like right
Described.
here.
There's no description.
Yeah, I don't know why. But this was that they had no expectations coming in. And so if you look at these two, people are expecting health department staff to be either extremely or very helpful 82% of the time. So that is great, because that is what we expect too. And when people, unless they said they had no expectations, we followed up with a question that asked them where those expectations came from. And the most frequent answer was previous experience with staff. So 61% said that it was their previous experience with staff, which is why that they were expecting what they were expecting. And so then the next question was how helpful did you find staff to be? And after it was said and done, they found 69, the most common answer was extremely helpful, and that was 69% of the time. And then again, if you add the very and extremely together, they found health department staff to be helpful like 96.5% of the time, which we thought was stunning, and Carrie said, yes, that is actually stunning. She said that if she had this sort of response on a evaluation from her class, she would be walking on clouds, because she does not get this sort of response. So she said, your front desk is absolutely not broken. That is, they are doing what they needed to do. But we did ask other questions, so I will share those with you too. One of the things that we know is that if we can explain the reason that the rule is in place, people are more likely to see it as a fair rule. They don't even have to agree with the rule. Just for them to know that there's a reason behind the rule, there's often a grudging acceptance. Okay, water quality, I get it, but I don't like it. They might not like it, but there's that grudging acceptance that they understand why we are doing what we are doing. That's, of course, we're not going for grudging acceptance. We want everybody to believe what we believe, and so, but that's at the at the lowest level. So one of the things that the land team has really done, I would say the licensed establishment team as well, has really captured or has created an expectation within their team that they will explain the reason for the rule, even when somebody hasn't asked, even when somebody doesn't particularly want to hear it. We need to be able to verbalize why our rule is in place. So first of all, it's practice for us. We need to do it in a way that is clear and easy to understand. But we need people to know that, so that when they walk away, they don't think like, well, that's stupid. They might be like, I don't agree, but at least they understand why we are requiring a septic permit, or they have to go through sanitation and subdivision review before they can get one. So we asked how well staff explained the reasons for the rules. And it was on a scale of 0 to 10, 0 being they didn't do a good job at all, to extremely well, and the average was 8.7. So yes, there's room to improve, but that is a very high average of what we did. And then this also kind of leads into that a little bit more. So what I said earlier is that we want staff to be knowledgeable, friendly, professional, and easy to understand. We don't want to talk in acronyms. We want to always be respectful, which I think goes into the measure of professional. We want to be friendly, and we want to know, we want to come across as knowledgeable, and we also want to not be afraid to say, ooh, I'm not sure, let me ask. And so the responses here are very high as well. Across the 4 categories, we have a 97% very rating. You can see that all responses listed environmental health staff as professional. And then there was at least one that was not at all easy to understand. And of course, we would like it to be 100% all of the time, but that would not be a realistic expectation. It is a realistic expectation to expect staff to be knowledgeable, friendly, professional, and try to be easy to understand at all times. So that is our expectation here.
What does that scale mean? Was there 65 people answered?
Yeah, I think 62,
Okay.
yeah.
Yeah, those aren't percentages.
That's a number.
Yeah, it needs a label.
Okay.
Cool. I just pulled that from a report that I didn't write, but I will add that as a comment.
Yeah,
Okay.
I have label problems when I'm making
Oh, yeah.
graphs.
Yeah. Okay, and then we asked 3 open-ended questions because then you can get actionable things. And so we asked, the first question we asked is what did we do well today? And, you know, we were asking that really thinking that we were going to be more in the middle anyway, you know, so that I mean, obviously, when you have so many people feeling that we are, that we provided the information, that we were extremely helpful or very helpful, we were going to have a lot of good responses. But we didn't know that was going to happen for sure coming in. So we wanted to have a chance for people to tell us what we did well. And these Carrie and Claire broke into 8 different themes that we answered questions well. There were some very general and positive answers. The staff was helpful, that we were efficient. Let's see, I have some of the specific answers. So for answered questions well, one of the answers was answered my questions and made informed suggestions. For efficient, quick process, very prompt, professional, very professional throughout permit process, responsive, called back after I left a message, and unbiased, listened to the question and made non-judgmental responses. All of that is great.
So again, we're still talking about the desk,
Yeah.
front desk,
Right.
right?
Only the front desk, yep. Yep, this is all that survey. And then the second open-ended question that we asked in that survey was, how could we have done a better job helping you today? And 21 people said nothing. 4 people said free services, and they said things like free parking and free coffee. One person said hours, and that was specific to the noon hour. One person said timing, and I don't know what that was about. It said, I could have come here sooner. I don't know, I don't have the context for that, so I don't know. And then one person at the bottom did say that this was a repeat visit because the first time they had come in, they got incorrect information. I also don't know what the circumstances are around that, but I know that happens, and I know that that's not something that we want to happen. We want to give people the right information all the time, but we don't always. And so then we just said, is there anything else you want to tell us? Just left it open. 13 said nothing, and then the general and positive comments were things like thanks, have a great day. You know, they were very general like that. A couple of people talked about more online information or having a quick guide so that you don't have to look through all the rules, which I'm not sure exactly. I don't know the circumstances around that, so it's hard to act on that. Dan Foltz got a shout out in several different places, and this was one of those places of him being very professional and helpful. That was why it says employee specific. The incorrect information, I think, was probably linked to the person who had to come in more than once. Incorrect information from other sources was a specific issue that somebody was upset about the floodplain, the FEMA floodplain, FEMA designated floodplain. And then the last one has got to be our favorite response because it was, for a free country, I don't feel very free. So that was their comment about what else they wanted to tell, the health department. That person also did not expect staff to be helpful at all. They and then found us to be slightly helpful. So we went up in the scale after they talked with us. So that was the the survey that we did, and, you know, we started to try to parse out the information a little bit more and think about, you know, how could we pull more information from this? And Carrie said, no, stop, you need to go on to your next phase, because this really is very good, and there's not a lot that you need to do about that front desk, as long as they keep operating the way that they were operating in that. So, and this is, I don't have much more, I just want to tell you about the 2 next phases. So the next phase that we're going to do, we've decided focus groups are the way to go, and that's because we are trying to get more specific information from people about what their experience was through the permitting process, through the septic permitting process. So we're starting with property owners, because when we looked at the number of permits that we issued more directly to property owners than anybody else. And we have worked with Carrie to figure out our script and some of the logistics and a letter that we're going to send out. And so we're hoping to do this in January or early February. And by hoping, I mean we're totally going to do it in January or early February. And then the next phase.
So how are you gonna get information to them? Won't be people coming in then? You're gonna send it out to people?
Yeah, no, we're gonna, and then, so we're gonna send a letter out that we've worked with the university, but then we are going to call them and say, we really want you to come in, and we're searching for like 8 to 10 people that can come in and talk about the process. And then we have a script that's full of very open-ended questions. And it's been a learning experience to put that together. So we're excited to do that.
You're
And then,
drawing from people who, how recently got a permit? Last year?
in the past year. No further back than the past year.
So very
that-
recent.
Yeah, hopefully
Random.
even more recent than that. And we decided that it would be through the permit process. So some people will have put in the system and some people won't. And we also decided that we were only going to ask people who were putting in a new system. So not a replacement system and not like adding on to their home, but building a new home. And so there's another project going on at the county, right, that's looking at permitting overall. And because we're focusing on that, we might get some information for that program, because those people will have had to get building permits as well, land use permits. So. And they're going to be in the focus groups with us, and so we're looking forward to that. And then the third phase, what we decided is that we really need to reach out to the community, and it's more focused about health department reputation and health department's place in the community. And so we want to do key informant interviews. Those informant interviews would be with realtors and with consultants and with elected officials. So we haven't developed it, we just know that that's the next thing that we're going to be doing. So in January we'll start fleshing this out to see what happens, what we're going to do with that. So I will leave you with this summary. First of all, your environmental health staff, land staff, is awesome. We are always looking for ways to improve. We want to improve. We like becoming more efficient and doing a better job in delivering our services to the public in a way, of course, that will protect the environment. And we are really excited to learn about the skills and then to apply them to other programs. So this is focused on this group, and it's been important to focus on a group because it's allowed us to look at it in these 5 different ways, right? And so then we can have those skills to figure out the best way to get information about restaurant inspections or pool inspections or, other interactions we have with the public. That's it.
Thanks, Shannon. You said that House Bill 507 addressed some of these needs. Can we then make the takeaway from that, the assumption that there are other counties that have these same kinds of issues, not just, was this directed toward, because it wasn't a Missoula representative that.
Oh yeah, no, it wasn't. It is a statewide issue, and there's actually a task force at the state level that's addressing how to improve the subdivision process, and we're part of that. But in fact, House Bill 507 sunsets after 2 years. So it's like, let's try this, but really what we want to do is talk about it for 2 years. And then they have to, the DEQ has to report to the Environmental Quality Council, and throughout the time to say how it's going. So they put in some new processes, but we're willing to say, let's see if it works. And if it doesn't, let's find something better, even better that will work. It started out being kind of a draconian bill, frankly, and
Yeah.
ended up being one that is working. And I have to tell you, and this is a reminder to me, we were not all that excited about the pre-application process, and we had our reasons. But it is, well, it's not just the pre-app meeting. Pre-app meetings are fine. The other thing that they put in is something called element review, and we felt like, oh, this is an extra step, but it's working great. So we don't even really get into reviewing a subdivision if they haven't provided all the basic elements. And that was one of the problems. I mean, we might not have a site plan. I mean, for one that we just, it's very basic, but you know, somebody either forgot it, I don't know. I mean, so then we can go back and say, you have to at least give us this so that we can be more efficient when we're doing our review. So hopefully it's a better use of
Yeah,
public resources.
But we were very, I mean, our perception going into it was very negative on that, so.
Yes.
It's interesting to see and.
Yeah, we thought this is adding process, it's not gonna help, but and it might not do what, it really is not doing exactly what the sponsor asked for when they were talking in front of the legislature, but it is, I think it can improve the process. So, yeah, it is definitely a statewide issue.
Okay.
Yeah.
Shannon, I have 2 questions. Do you remember who carried 507?
Mandeville.
Okay. And you mentioned that your work with Carrie and Claire is on a 1-year contract. Is there
Mhm.
going to be time to get through all 3 phases with them?
Yes, in fact, they are impressed with how we are forging ahead. So, yes, there is.
Because we
Yep.
started it kind of a little later than we thought.
Yeah, we started, we were gonna pick up,
In
the
May or
session was
something.
just well, it was before the session started, we were gonna pick up with the quality improvement project that Gina had started on with all that rich data, and take it further and really, and that's when we had, you know, management changeover and staffing problems and added a person, and that kind of sat. Then, so we had them on contract when 507
Came
became
up.
known.
I thought the contract started more like a little bit, I mean, we were talking, but I think
I was
that-
talking with them before you were, so,
Yeah, but I don't
And then
think
we
I don't think the
switched.
contract was until really till the summer.
yeah.
So-
That's
No,
what I meant.
originally
But anyhow,
we thought it was gonna be sooner.
We
Yeah, yeah,
switched and
Well, it took
backed
us
off
time.
of the dive deep in just the sanitation and subdivision and said, let's learn how to do this and let's look at the whole thing from the front desk through.
Yeah.
And so we're using that approach.
The other thing is we thought the quality improvement project that we started and was taking us a super long time to complete was gonna be no longer needed because of House Bill 507 and because of the state group, but we realized that's not the case at all. And so it's okay for there to be more than one thing happening. And we shared our QI project and the information that we had gathered through it, and it's helpful to that conversation at the state level. Yeah.
All right, well, thanks, Shannon. I guess the next item on the agenda is update on community decay and complaint filed against M2 Green, which is also what you're going to lead us through.
Yes, so Anna is not here today, and so we talked with, Anna and I went on a site visit with Wakefield representatives, which are, they're the lender that Jean was talking about earlier. And as far as everybody seems to be concerned, M2 Green is really off the table as far as somebody who's going to be able to get something done. And Wakefield is poised to foreclose and on, I guess, 14 of the 15 properties. And so they are willing to discuss coming into compliance with the community decay complaint. And since the auction happened, which is when the first money came back to the county for the taxes, a lot of activity is happening out there, some of which has cleaned up some of the community decay problems, some of which has created new community decay problems, and they were sharing their frustration with us that they, you know, when people came and got their stuff, they just left all the garbage everywhere when they were supposed to clean it up, and they didn't. But they have somebody out there working, and I can tell that there's a difference. Even with that destruction of things going on, there is attention to keeping the property clean that wasn't there before.
You were there, you and Anna were there Friday.
Yep, on Friday. And on Friday, if anybody was out in Frenchtown, there was a nice thick fog. And so what we were there to talk about is what is visible from the road, and I can tell you nothing was visible. And so, but what we of course did was we drove around and we talked about, you know, that's in public view, that's what Community K is. And you know, it's interesting when you get to an industrial site, it's not like industrial sites are beautiful to begin with. But what we were looking at is what is decrepit, what is falling apart, what looks like
A nuclear bomb hit in.
that is right. That's what we were looking at. And so, and one of those is a great big building, right? And which I think that you guys have seen when we showed you the pictures. And so we focused on that and some other things. There are some things that they could probably shield because it would be hard for them to deal with some of the concrete stuff on the ground. And but we looked at a lot. We also talked about things that weren't in public view that that are solid waste, but they have plans for almost everything out there. They've done a lot of cleanup, and they do seem to be putting the time and resources into getting that property cleaned up for sale or development. And so Anna is now drafting a compliance agreement, and Wakefield is willing to engage in conversation about timing and what they'll do to get it taken care of. So that it's not over, but it feels like a win. Yeah.
Good, all right. Thanks, Shannon.
Yep.
So the next item is update on foster child health funding and targeted case management funding.
Boy, you were optimistic to put that on here.
Yeah.
Hopeful.
I'm gonna draw you a not very good picture, because I'm not a good drawer, but I think it'll go faster this way, so. And of course, I have a yellow marker.
Just don't know.
Just gonna move out of the way. That's not gonna work.
Kathy's gonna run and grab.
Oh, thank you. So this is where I believe we are at adjournment of the special session. That said, there was stuff that went on late at the night. I don't think affected us, but I have to put that caveat out there until you really go through and interpret everything. So out of our MCH, maternal child health activities, of which there are many, in Health Services Division. I mean, WIC itself is a maternal child health activity. Immunizations is also in many ways. If we pull out our thinking and our budget as it relates to the things that the public health nurses do in working directly with families with evidence-based home visiting, Medicaid targeted case management, and those types of things, some of which are grant funded, tax funded, with a little bit of Medicaid reimbursement that accrues for all of those programs, okay? Helps you make the margin. And then our really special pilot work that had started to spread across the state, the foster child health program. So if we look at the MCH budget and pull it out of the rest of health services, it's about 1.6 million for those activities. And that is 53% funded by non-tax revenue. So non-tax revenue in this context is not local taxes. So primarily grants, Medicaid receivables, okay? 47% then is the local tax support to that. We had at risk going into even before we went into the session, thank you so much. So 1.6 million for MCH. Again, you won't see this as a discrete category in the budget, so I had to pull. And about 57% non-tax, all the things we just talked about, revenue, and then 47% tax revenue. This proportion has grown quite deliberately. You know, we've been working very hard, the staff has been working very hard to get all of these revenues up by competitive grants, nurse-family partnerships, Safe Care, and we got a lot of TCM and the targeted case management Medicaid. So if you would have looked maybe 5 years ago, it might have been the other way around. So very deliberate growth. The irony is, because we grew this as well as we did, we actually had more to lose when those kinds of monies, right? That's the way that it plays out. The total amount that was at risk, and some of which has been lost, and some of which, with my caveat, I think has been preserved, is 210,000, which is about, and it's out of this piece of the pie, but it's about 13% of the total pie. It's a chunk. It's really a chunk. That comes from two pieces. I know my writing's terrible, but I'm sure you're getting the picture. One is the foster child health money that we're getting from the state for the past 5 years. So we had the county commissioners' seed money to do the foster child health, some of our local tax money, in-kind support from Providence, St. Patrick and their special clinic, agreements with Child and Family Services at the state, and then this would be our 5th year that we'd be getting and growing money on a per capita basis for kids that were referred that are already in a state custody situation. And we budgeted $65,000 based on what we've been able to see in our performance. So $65,000 of that was on the governor's first list to be cut. But you know, the legislature and the governor worked on the second list. So we knew that was at risk. Before the session convened, the state health department sent us a letter and said it is gone effective last July. We had already billed for some, so we got some. So that, so if you looked at the governor's cuts, there's so much sleuthing involved. If you looked at the governor's cuts, the second one, the one that he enacted 5 minutes before the session started and all of that, and that they largely adopted, that's my caveat, it would look as if foster child health was saved. But a couple phone calls and basically what I got the DPHHS finance director to confirm is they took it off the list of governor's cuts, not because they were cutting the money, they were taking the money away from the service and keeping it at DPHHS. So that's what they did with that letter, and they did that in Yellowstone County and Cascade, who were, you know, replicating our pilots in their own ways. So that money's lost, that $65,000. We got an invitation from Providence St. Patrick through Mary Hutton as soon as they knew this money was at risk to put forward a request. Vicki Dundas, I think, had that done in 48 hours. And she's, you know, they have that. They're waiting to see the aftermath. But, you know, a money request to see in which way they might be able to help. The rest of this is the targeted case management Medicaid money. We were the pilot for that in the mid-'80s. We've grown it. It's very hard. Only larger health departments have been able to come up with the wherewithal to actually bill for this and to do it right. But this is that really important money. Last year we brought in $190,000 just for high-risk kids with special health care needs. We budgeted $145,000 though because I didn't want to budget against a spike, and I knew we were having a change in management and some vacancies, so that affects your revenue generation. This went in, and the second governor's second round, the one that went into the session, the cuts he enacted, with the reduction of, because it's a projection, the reduced amount changes the further you get into the fiscal year. So anywhere from 13% reduction up to 18% projected. So for us, that's about 24,000 out of the 145 we're budgeted. So 24,000 plus 65, you know, we're looking at a little less than half of the 210,000 that was at risk. So that's good news if that held. That's my caveat. We have an underlying problem that I complained to you about last month that we've been working on, and Anna Conley, I wish she was here, I'd glitter bomb her, because boy, when she takes something on, she's not only effective, she's as fast as I've ever seen. But we decided to go ahead to address the rule change that DPHHS had made without any notice to any of us as TCM providers that in effect cut more than half of our TCM revenue, because it would cut our clients off if they went to certain clinics with the idea that somehow they got that service in a clinical setting instead of in their home, which always sets my hair on fire. But anyhow, we complained about that to the extent and notified others of our colleagues. There's only 8 providers in the state. None of them were notified. Shouldn't be that hard to notify. Complained about that, and Sheila Hogan and Marie Matthews, Sheila Hogan being DPHHS director, Marie Matthews being the head of Medicaid, the new head of Medicaid, and then some colleagues that are not in Medicaid but are in the Public Health Bureau, carefully complaining because there's, internal awkwardness. And we got word just before the session that they wouldn't enact that part of the rule change. So we didn't file our petition. However, that rule is on the books as of October 14th. So now we have to look at how we're going to get DPHHS to seriously to reverse that rule, not just the duplication of payment part that I think they're thinking is erroneous on, but they changed the definition of targeted case management, so it's not a home visiting. It basically can happen in a clinic.
Oh.
And I noticed that Mickey just groaned. So we aren't out of the woods, because when we looked at just what they believe to be duplicative in our clients, we were over 50% at our first glance that we would lose half of the money. So this would not be half on top of the 20% cut. So I mean, you'd virtually be looking at losing the vast majority of your money. So that's the next step on that. So better than it could have been. We have some options, and we'll just keep going at it. What I want to express, besides appreciation for Anna, is the immediate support I received informally from the board, the county commissioners, and I said, look, we might have to file at least a petition to get this going. And, a petition, we don't want to do it in a big adversarial way. We don't want to be around, saying that it's ever okay to write a rule in this fashion. Lots of support. That's the kind of support and resources and political background that a lot of my colleague TCM providers don't have. I realize that can make Missoula look more like the adversarial partner, but we're being very professional and clear. And so actually I have an opportunity to meet with Sheila Hogan on Monday through our professional organization of AMFO, which helped lobby over these last 3 days. In fact, I conducted a really fast survey where I didn't have to worry about regular community of all the TCM providers just going into the weekend before, and use that data as part of our lobbying points. And so we're hoping that same data, which defines the service the way we believe it actually is constructed to be, and also talks about the number of children and the number of visits that we're able to bring about with this little bit of leverage of funding. We're hoping that that same survey data and talking points will be useful in the rule change discussion. So that's kind of where we're at. If we file for a full rule change, though, because we don't really know what Marie said, Marie Matthews, we'll hold off on that. Did she mean the rule? Did she mean just the duplicative payments? And that's not a way to operate on a rule. So that's all yet to be determined. Thanks. And the nurses and that whole staff, we had a meeting with them yesterday morning and let them know what we knew yesterday.
All right, next item on the agenda is number 4, to approve the October 19 minutes.
I move to approve as presented.
Motion on the floor. Any other discussion on the motion or on the minutes? public comments on the motion? All in favor, say aye.
Aye.
So moved. All right, with that, we go on to item number 5, which is a succession policy, which is probably our main action item
Yes.
today. Ellen's please.
So there are changes in there, in addition to the ones we discussed at the last meeting, that I hope are improvements. I got some discussion from the top-level managers who would be called in on this, and so the additional changes almost all exist in that very last subsection that I added. I think I added a B and a C.
First most available.
Yeah, first most, I wrote that, first most available. I had a long phrase before that, got it down to most available.
So the main changes to what we already had is in the last temporary
Yeah,
assignment of.
those are the ones you did not discuss, those last two. All the rest came from the discussion here, changing the order of things, making sure we realistic health officer type those.
They still reflect what we talked about though.
Yeah, I think the intent was to explain it better, so that not only you knew what was going on, but that the chief management staff knew what their instructions were and what they could and couldn't do if they ended up as a acting director. You want to fix it? Go ahead.
No, it's fine.
Oh, wouldn't it be nice if we had a federal secession?
We do.
Yeah, well,
Oh, trees, and I hope it happens pretty
Yeah,
soon.
and the backbone to use it.
That one too.
The 48 hours. Well, I mean, you can send an email, right? But those were lessons learned from PHC. I mean, they had nothing like this. And the staff was jumping in, doing the job. I mean, they had some succession plan, but the board had no information for some time. And so lessons learned that we hope we won't need here, but there they are.
I'll make the motion that we accept the succession plan as presented with the corrections or the additions. Corrections and additions.
Any further board or staff discussion or comments on the succession plan or the motion?
Can your motion include that it goes into effect or?
On the signature, or upon action. Today.
It's implied, isn't it?
Yeah, today.
And adding to my motion that it will become effective upon signature by the chair.
Any public comments on the motion or the succession plan? All right, all in favor, say aye.
Aye.
So moved. All right, so that'll get signed today.
Thank you.
All right. Then we got the November journal report.
Okay, I'm shooting for 5 minutes, watch.
Awesome.
Yep. Okay, one of the things you're supposed to do as you get older is you're supposed to lean into things, right, that you don't like and aren't comfortable. So I've heard. So, actually, if it's the night before the journal report, you gotta find an article you can probably, so there's also that. So this article's from the current journal, the current issue of the American Journal of Public Health. It's about a useful aspect of tweets. I chose it because I could understand it. I had it available last night, and I hate tweets. I hated the idea of tweeting or whatever. When it first came out, I continue to hold on strongly to that attitude and have come to actually loathe tweets as perhaps not good for national security. I'm sorry, that is editorial. So, really had to lean in to this. And lo and behold, this interesting group of researchers, an epidemiologist, a biostatistician, a computer scientist, a sociologist, and a kinesiology and recreation professor got together and they looked at and found that geotagged US tweets, that's the continental US, not our other Hawaii and Alaska, are predictors of county-level health outcomes, according to this. So it's a use of real-time data. I don't know mechanically, electronically, how they rounded it up. And it's also, so it's not only real-time, it has some predictive value for county-level health outcomes that are already recorded and known through different sources. And they also talk about it as, this is another aspect of, big data, the whole emerging idea of big data now is available, how do we use it? So I thought, well, that's cool. I might like tweets temporarily. So they took 1% of geotagged tweets, and only 1% of all tweets are geotagged. So it's a very small amount, but let me tell you that was 80 million tweets, 1% of 1%.
I'm like,
And
Another
that's
reason.
within 60 seconds, right?
Yeah, whatever, I don't tweet.
Yeah, with them.
I'm hanging on to that attitude.
I bet the time is short.
So anyhow, lots of material, took half, 1% of 1%. They did find, of course, it's not generalizable in a big way, but it's more viewed as big data, but it is predictable at county levels for some already measured outcomes. They also looked at sentiment, and sentiment was really just binary, happy, not happy. And then they had a lot of classification that they did. What kind of tweet got classified as happy or unhappy. And they looked at food, physical activity, and alcohol related tweets. And they classified all those by, is this a high density food that we see the picture of? That's, all those people that put right. Is this a healthier or lower density food? What are we saying? I'm sure there's an awful lot that could be challengeable, but they describe their whole methodology for categorizing 1,400 food types and almost 400 physical activities or lack thereof. And they looked primarily at excessive alcohol, which is sometimes called binge drinking. So then when they got that data, they first just looked at what the fun part was, what is that data telling us overall before we even relate it to county level health outcomes. And Montana came up with a list on a few times. So they found first that the reports of healthy food, or the things that signified healthy food was on the table or at least being tweeted, occurred mostly in the summer months, June, July, August, the produce, but also in November, which was not fully explainable. And
Vegetables.
Thanksgiving?
Vegetables.
I don't know.
Brussels sprouts.
Depends how many
Yeah.
different vegetables you have at Thanksgiving. And then the high caloric, what they quoted as the less healthy or unhealthy food, surprise. It was also November, but then went into the winter, December, January, February, with the addition of April. Again, that would be complete speculation.
Easter.
The best
Ramadan.
activities, yeah, Easter. The best, the highest level of physical activity tweets of the 400 some that could be considered. I'm out gardening, or I ran a race, or I did, showed up in Montana, Arizona, Wyoming, and Utah. So we've got the mountainous
It's outdoors.
area, and Maine.
People are hiking and.
Those were the 5
mountain
areas.
biking, Funny, skiing.
And the happy frequency was Montana, Tennessee, Utah, North Hampshire, Arkansas, Maine, Colorado, New York. And the unhappies in general were Louisiana, North Dakota, Oregon, Maryland, Texas, Delaware.
Yeah, Oregon's surprised me.
West
They have
Virginia,
marijuana.
and Ohio, and of course, that doesn't necessarily translate to health, so let me get to the point. The correlations that they found, using these tweets as categorized and those county-level geocodes, they were able to line them up with Centers for Disease information, behavioral risk factor survey information, which of course is county level, fatal alcohol reporting system is related to alcohol and motor vehicle crashes and deaths, and I forgot where the last local, also BRSS,
Behavioral risk.
behavioral risk factor survey, which has been going on for almost 30
It's that
years.
questionnaire that goes out.
So you get
Kids and-
self-reported height and weight, so you can, do BMI from that. You get, for adults, it's only 18 and over. You get self-reported fruits and vegetable, and you get self-reported alcohol consumption. So when they took those, the correlations that they found is those geocoded tweets that had a higher incidence of good food and activity levels actually had a lower number of premature deaths. So the average number of premature deaths per 100,000 was actually 8,000 premature deaths, less than age 75 was their definition, per 100,000 people. In those geocoded areas that had the high good food and activity levels, they were able to subtract 714 premature deaths out of that total. In the adding the happy category to the high food and activity tweets, they had up to a 2.5% lower adult obesity self-reported rate and up to a 3.6% lower rate of complete inactivity or sedentary behavior. And those that had the higher alcohol tweets, they actually saw 2 to 2.2% higher reports on the BRFS of binge drinking. And unfortunately, like many maps, when they play all this out, they made an interactive map, but here's just a static picture. They found that worse rates overall for all of these were in the South, where you see the same poverty rates, obesity rates that we see. So I thought that was a good use of Twitter data.
I hope they keep doing that, and I hope they predict flu outbreaks with it.
They talked about that, and it was not 5 minutes, but it was good.
I hope they keep doing that.
Oh, they
It's
should.
an amazing
It's
data
just-
set.
It's, yeah,
The happiness and the suicide doesn't
right.
link
We're
up for
happy,
me.
but we have suicide, right?
Well, but
They're
that's a
not
self,
tweeting.
that's a self-selected, right,
Right.
group. The folks that are depressed are not on,
Yeah.
right, social media.
So I mean, they could keep doing it
Maybe
without the
they are.
happy.
Some of them are.
Right.
Yeah,
Facebook
it
Yeah,
was
here are a lot of
grouchy.
miserable people on.
Yeah.
Yeah. I don't know.
Do you like it any better now?
I think we could do without it, but
too.
I thought it was a useful way to take the kind of data that maybe wasn't put out there for that purpose. Yeah,
Interesting.
yeah.
Well, I think all these apps were actually developed exactly for that purpose, to collect data. It's just people don't.
This
Right.
is a byproduct.
That's the only reason why
of-
they exist, is to collect data.
Yeah, so they know what to sell you.
Yeah.
That's why you get
So
the
got a higher
ads with
BMI,
anything you
put-
look at.
Somebody had told us
Send more vegetables to
25 years
Montana.
ago
I don't have
that
more
people,
diet pills.
that people would carry around, by choice, an electronic device that could tell the world where they were,
What they're doing.
where their friends were, what they were doing, and showed pictures of what they were eating and who they were with. We would have said that sounded like
Far-fetched.
Aldous Huxley.
And those are the same people that don't want to register their firearms,
Right.
right?
Well, I don't know that part, but I do know that you
They all
can,
have smartphones.
you can get a lot of information that you don't, every time my
Well, the
phone
thing-
says, did you want to turn on your location? No, thanks.
Well, here's a problem with a bad attitude. As I said, I have a really bad attitude about Twitter. I would have, in a million years, I could have sat around with nothing to think about. I would have never thought to do this study. So I think, that's really cool that you can just kind of open your mind to it and let's use it for something good. I think that's, for me, a takeaway.
I'm still not gonna do Twitter.
Thanks, Ellen. So then our next item is to identify a volunteer for our December report. Let's see,
I think I'm,
Joe.
I have to look at my calendar.
It's actually December 21st.
It's December 21st.
It's very close to.
And in
Are
our,
we having a meeting that week?
in our early poll, we have 2 definite confirmations of attendance, a 3rd likely
Okay, here.
confirmation from Debbie if she's not traveling.
I said I didn't know.
Jean and Teresa said they didn't know. Garen wasn't available.
Do we have
I
any
mean, that's.
Do we have
agenda
anything we
items?
have to do?
So we don't have a quorum yet.
Well, we do have the tobacco, or the, I will call them the smoking
Mm.
recommendations. They can be done in January. I mean,
I could be traveling.
Oh,
It's a Thursday,
yeah.
it's a Thursday
Because is there any
before
court
I
related
think I'll be
anything?
here.
we can also look at moving it up a week, like to the 14th. But right now, we don't have something that the board has to convene over.
But I think the
I'm going that week.
14th is probably our public meeting.
Yeah, so we might just be looking at January. But we have to Rose Garen somehow.
But we don't know for sure if
If
he'll.
we'll even see him on the
Be
21st.
attending.
Right.
Couldn't we do a social event to do
Yeah.
that? So then I could come.
Yeah, that would be fun.
We just have
We
to
could buy
notice
you a-
it if we have at least 4 board members present.
Then we need to have a no host
We can,
snack
sure
bar.
we
do
can
that.
notice
We
it.
could, I don't think Christmas is a good time to do that. We could
No.
do it January.
Yeah, we can pump
Or
that.
we could make Garen show up for the January meeting. And I hate to make Teresa show up for another meeting, because she's been trying very hard to resolve.
Get out.
Were you gonna talk about the Children's Museum?
I can,
So the Children's Museum is closed today because it stinks too bad.
no smoke.
But here's I can't figure out how to forward it, but I figured out how to save it. The Miami Cigar and Company, thank you for the Fool's End and everyone who came
Can you
to
share
a
it?
place.
The Cuban cigar.
When I hit share, it doesn't,
Does it give
If
you
you
a
hold your
way to
finger
share
on
it
it,
on
can
the
you
top,
save it?
top right-hand corner?
Gene and I tried to share last night, we needed someone.
Yeah, smarter.
You need a 5-year-old.
Do you want me to help?
yeah.
Julie's younger, she can do it.
I can't do it.
So, back to identifying volunteer for a journal report. Sounds like we may not even have a December.
Oh, that's the,
You may have just Christmas instead.
that's not the very
Right.
interesting.
So, should we, let's see. Should we just look at appointing a volunteer for our January
Let's do that.
journal
Yeah.
report? and Just skip December, at least as a journal report?
Mhm.
So,
I can do January.
okay, great. So we'll do that.
Here's
Goodness, my
copy.
appointment ended. I need to extend my health board appointments into next year.
All right, so then that satisfies item number 6. So item number 7, instructions and deadline, complete Board of Health self-evaluation survey for 2017.
So we were potentially going to have you review the results of a self-evaluation survey in December, but that can go later. Other years, we've sometimes not taken care of that task until January or February. The plan at the moment is that I'll send directions on Monday of next week on how to complete the survey. I'm trying to set it up once again, as I have done for several years now, in SurveyMonkey. However, you might recall the last 2 years that I've used SurveyMonkey, there have been problems in how it calculates the results, and they've not been accurate. So I've been testing, and I still need to finish out a little bit more testing tomorrow, possibly this weekend, to make sure that the survey is really going to work and give good calculations. So on Monday next week, you'll receive by email either instructions on how to log in to SurveyMonkey to go ahead and complete the survey, or I'll be sending you a Word version similar to how we do Ellen's survey, and you can either fill out the Word document online, fill it out by hand, send it back to me in a similar fashion to the method that we use for Ellen. But whichever version and approach we take, the information will go out to you electronically on Monday. And the idea then is to have all of the responses back by December 11th. We need at least 4 board members to participate in order for you to review the evaluation. And so I will send reminders every week to please turn in your surveys, because once again this year with Ellen's, we had to extend the deadline 3 times, and it was board packet day that I was still trying to compile the last of the survey information
That would be my fault.
so that we could do the survey. So it'll probably be set up once again in SurveyMonkey. I think that's simpler for all of you, and it's certainly simpler for us. But I just want to make sure that we can actually get useful numerical data out of it in terms of the scoring.
I figured out how to send it to you, Ellen. I found it.
Okay.
So next item on the agenda is maternal child health advisory consultant, Teresa.
Okay, I am really pleased with the kind of the steps that we've gone through in the last year. The Maternal Child Health Advisory Council is truly a community-driven group of people, and over the years, the membership has dramatically decreased, so our goal for last year was to increase the number of participants, and we have done that and have more community, et cetera, members. And that is really a good thing. We have tried as a group, well, I've been acting as chair for this last year, and the focus is generally sort of whatever arises out of interest level or issues that come up for in the participants. So more than a year ago, based on the strategic plan and the community assessment and et cetera, we took it upon ourselves to hear and learn about the ACE study, the Adverse Childhood Event Study, and looked at impacts that we could consider in our community to respond to adverse childhood events. 2 of the things that are most prevalent that contribute to those are poverty and substance abuse. And since we've been working on trying to fix poverty, but that didn't necessarily, it's not a really easy action item, we looked at both.
We're counting on you.
Thanks. I'm just about done now. Then we also were looking at the idea of substance abuse and family violence as 2 of those things. So we have been trying to gather information, et cetera, and do some various data collection. One of the things that came up over the last year and a half to 2 years was the interest in opiate exposure and childhood or family access as one of the things that happened with that. And so we had been working with different members, going to Healthy Start, Best Beginnings meetings, and an outgrowth of that has been that Anna Semple, who's the convener for neonatal abstinence syndrome group that's based out of the Forum. Neonatal abstinence syndrome is the diagnosis and symptom grouping of newborns that are reacting to a mom who was opiate addicted or opiate using at the time. So one of the things that have been happening, my whole point to this is give you some background of what's been going on. So different areas of our county and community have been looking at opiates, access, suicide, depression, teenagers, newborns, moms, et cetera. And one of the things that has happened with that is that providers of all kinds of services have come together and have developed this neonatal abstinence syndrome group that meets once a month for an hour generally at community hospital. And my point is that I would really like whoever is involved with the Maternal Child Health Advisory Council continues to have some of that access. I would also like to propose or to recommend that this group, the Board of Health, ask for a report of the status of that group from Anna Semple. I think you'd be quite fascinated to look at what's going on. The other piece that happened as a response to that is that some of our members, specifically Heidi Halverson, is a dental hygienist who's very public health and community oriented. And we started talking about the fact that one of the ways, and Brandy Tyree, also from Forum and Prevention of Childhood Substance Abuse, or I don't know what the title is of actually her real job, but it's like
It's something like that.
substance abuse
Reduction.
prevention
Yeah.
in children and youth
Specialist.
or whatever.
Understand.
But anyway, one of the things that has been identified is that, again, prescription drugs at home are one of the ways that especially young people or children or family members find access to drugs. And just before our meeting 2 months ago, there had just been an NPR podcast or whatever about dentists' prescriptions following wisdom teeth, et cetera. And Heidi, who is an adult dental hygienist, well-prepared, et cetera, had a dental procedure just before that and was sent home with 20 OxyContin. And so we talked about the fact that that is a currently sort of usual practice, and there's all sorts of reasons for that, but she used like 3 or something, and she was, anyway, so then we started talking about, okay, given this NPR and community awareness, what was going on in our community? So we talked about, and Heidi proposed that we should get some information and ask the dentists in the community. So she talked to Dr. Mentel at Partnership Health Center, who's been very involved in substance abuse, et cetera, and talked at length about that. And then we talked to, she made contact with dentists and Brandy Tyree. And anyway, and the result was that it was recommended not to survey dentists because it's really hard to do that without being accusatory at this point of figuring out how to, it's really hard to develop a question that says, so how do you?
Can you make it anonymous?
No. Well, we try, anyway, so the recommendation based on the people that we've talked to about should we do this survey said no. So what they recommended was that we, the dental community, identify a dentist as champion to look at this issue and have it come from a dentist as opposed to the Maternal Child Health Advisory Council saying we heard this report on TV and radio and heard that you guys are part of the problem. Because they couldn't figure out a way to make that not, even if that's not what we said and that's
Soften that
not
a
what
little
we're
bit.
asking. Well, we weren't asking that, but it's like, yeah, good luck on that one. So we decided that would not be a realistic option. So what Heidi and the group is still working on is to gather some more information. To that end, Heidi's going to continue to work with the dental community about trying to identify a dentist champion. And the next meeting in January of the Maternal Child Health Advisory Council, which will be on January 9th, Vicki Dundas is going to contact Brandy Tyree and Dean Christensen to speak to the Maternal Child Health Advisory Council about the status and the current problem with it, because we're still kind of. So my happy place is that we've talked about this as an issue that came to us from different members of our group, and there is indeed our responsive community that is saying, yes, let's look at this, which is a swell thing to do. So before the next meeting, there's an article is being forwarded, hopefully, and circulated to a link to a New Yorker article. I don't have the title for that, but it would be in our minutes about the marketing and financing related to the medications that came out, OxyContin, et cetera, just to give us some perspective
I
of
saw a
how,
headline about that.
about how that all was happening.
Can I give you 2 other doctor groups to identify?
Orthopedists,
And plastic surgery centers.
Oh.
well,
Yes.
generally pregnant women don't go for their plastic surgery at the same time of their pregnancy.
I hear you, but just it could be,
Yep.
it's
Yeah.
amazing how many, I mean, they'll give you 30. Especially most women will get something done on Thursday or Friday because they're taking off the weekend and they know that they can't call their doctor, and so they'll load them up.
Well, right, and then there's the whole thing about the whole culture of why
I'm just
can't you
saying
call a
it's at
doctor?
home in the
Right.
cabinet, you know, because they.
And then somebody can't, if you've got 30 or 20 or whatever, can somebody tell when somebody took 2 of them and whatever? Anyway, so that's, yes, so that's, there's a whole bunch of reasons for that, but current practice is that there's like routine prescription pads that are given for a variety of situations, and I don't know how that practice was
Usually 10 or
de-
30.
was developed, but there are reasons behind that, and no provider likes to have their practice questioned in general. So anyway, so that's a whole nother thing. But so the next Maternal Child Health Advisory Council meeting will still be looking at gathering continued information about opioid exposure to pregnant women and the neonatal issue, because we've talked, because then one of the things that we did was elect a new chair, and Blair Davidson, who is a psychiatrist here in town who does adult and adolescent and child psychiatry, is interested in, said she would be chair of this group, and this is an ongoing issue for her and her patient population, as well as she would be interested in applying for the Board of Health position.
Yeah.
So that's part of my report there. What I would encourage either the board or the staff or whoever is to figure out whoever takes this position, that if it includes the liaison to the Maternal Child Health Advisory Council, that we either continue to have some connection with the Healthy Start and/or the neonatal abstinence syndrome group. That adds a lot more meetings. Vicki Dundas goes to many of those as a staff member, but I would think it's really important for those pieces to also get connected back to the Board of Health. And I'm not sure how to make that all happen, but one of the ways has been to make sure that somebody at the Maternal Child Health Advisory Council has a report. So if that person is not the new member serving at the what do they call it? Serving at the pleasure of the county commissioners is not the liaison to maternal child health, then somebody with the interest, or you make some designation for that, because it's really interesting and good work. The neonatal abstinence syndrome group meets monthly on a Tuesday, just this past Tuesday, so it would have been however many weeks that is, at the Community Medical Center at 9 o'clock in the morning. And Maternal Child Health Advisory Council meets at noon that same day, but every other month. So I would encourage that you continue communication with the various community groups and providers, et cetera, with the Maternal Child Health Advisory Council, and continue the liaison position, and that the forum, the NAS convener connected with the forum report to the Board of Health at some time.
Teresa.
Thanks, Teresa. Yeah. Interesting challenge for us to get a new board member appointed.
Yes, we have two.
Yeah.
So I'll put that pitch right out there to that camera.
Yeah.
We're
that's-
looking for folks in public health to apply and folks with science background like Garen has had, so if there are folks
Are
there.
these both
we can-
positions that are
County.
county
County.
commissioner? Okay.
So they need to apply, they can go right to the county's front page and there's a place on there to apply for boards or just call our office.
Is it okay if I put that link on my Facebook page?
Oh, yeah.
Because I have former.
push it out.
Yeah.
Okay, I have former nursing students who have been professionals now for 10
Right.
and plus years.
No, we really want that particular.
We've been sending it out, not selectively, I mean, just to get a good pool of applicants.
And when would the applications for your seat be?
My understanding is that at this point, the application would close the end of November.
Yes, November
'Cause we-
30th is the deadline.
Because we need to interview in December, so we can
Both-
appoint them by the
for
first of the year.
both Karen and Teresa's seat would be that same.
Well, see, so you aren't already interviewing, but you do have interviews scheduled, so I reported that incorrectly to you.
Okay.
When they come in, they,
Yeah, we can interview before it closes.
yes, they get them on the calendar,
Okay.
because their calendar's tight.
And I have to say, this has been, it's a wonderful board position. I've learned so much, and at the risk of sounding like a real nerd, but it's been so fun to, I mean, like, what I've learned about, from air quality and the water, I mean, the field trips have been just terrific. Field trips have been great.
There, this is the camera you're talking
Oh,
to.
the field trips are great. Anyway, I just think it's important, and I would like to encourage the former nursing students, because a number of the people in the Missoula campuses here have come to meetings, so they
Yep.
know some of what it's involved, and many of them have been out of school for 2+ years now, so I told them they had 2 years.
Okay, there they go. It was in their assignment, right?
Yeah, it's like, yeah, you can.
All right, well, then the next item is number 9, Director's Report and Accreditation Update. Ellen?
So I just, maybe we'll see at another board meeting, maybe we'll have a social event. I don't know, but I'm not gonna let this meeting go without all of us taking a moment to thank you
Yep.
for, obviously, your expertise, your time.
You could bring a little more enthusiasm.
Your just be there when there's a cause to fight for. I don't have the words for it, but I remember thinking we'd never get you on the board because you had so much else going on, and boy, you just readily agreed to apply.
Well, I did get tears in my eyes when I found out that I called up my husband and said, after I lost the primary, and it's like, I'm applying for a board position and there's more people, I might not even get picked for a
Oh, that's right.
I might not even get picked for
I don't remember
a non-paid
that.
position.
I don't remember the commission having any problem with that selection.
I know, but it was just, there's a lot of people interested in it.
No, we were so lucky, and for me, it goes back even further, because if I remember correctly,
We did the triangle 25 years ago. Primary care
Right.
prevention,
I
back the
think-
first time in the
Well, it was-
80s when it was
it was
the
Hillary
early 90s.
Clinton's 1993 healthcare reform.
Yeah.
And you and I would
We did the dog and
station-
pony show.
We didn't even know each other then, because I left the faculty, and I think you came on when I left, so, and there'd be these two, excuse me if I'll speak for myself, noisy policy women in the corner of healthcare reform, just volleying back and forth, that this had nothing to do with the health of the population. or
Oh, yeah. Dorothy Bradley would say, okay, and now whatever Teresa and Ellen.
Yeah, yeah.
Let me just
And we
add
followed
this.
it, and we always kind of covered the room that way, so. And then, of course, the legislature, you tried to help us get the foster child health
Mhm.
program when we first lost it. So we have another round again, and keeping that maternal child health focus is what has been such a critical, it's great to have a public health nursing professor. We've had that fortunate to do that. Because because the board didn't used to have the maternal child health focus, and it's really, really brought that. I believe you bring a very strong one, but I also think anyone who has that maternal, let's get them while they're young, kind of community-based focus is really what you've brought and held down from the people before you. So I appreciate it, and those of us who were available signed a very small token, very small token, but a very heartfelt token of appreciation. It's been very wonderful.
You've also given passionate speeches about the need for early childhood education. I remember thinking, people should listen to her.
Yeah, it's like, geez.
Makes sense.
You should have time to read at least one more book with some
Oh,
reading
yeah.
in my year. So that's what we hope for.
Cool, thank you.
Thank you.
Yes, I've read a lot of murder mysteries lately.
I expect we'll see you again in some form. I hope that we will.
I just can't commit to meetings every
No,
month anymore. I just
absolutely.
can't do it.
You have more than
I don't, it's
more than
time
we-
to hand over the tiara.
Yeah.
Thanks.
Well, thanks, Teresa.
Yeah, thank you,
Yeah.
Teresa. It's been more than a pleasure.
Now the director's report.
That was my director's.
That was it. That was it.
That's it. I wanted it in the record.
Well, with that, I guess we move on to public comments and items not on the agenda. Seeing none, board or staff comments and items not on the agenda.
I have a couple. Go ahead.
No, if you want to talk about that.
I want to bring awareness to the fact that we had some of our neighbors here in Missoula freeze to death and pass away about 10 days ago, and that should not be happening in this community. And I'll be working on a couple things, and I know the county commissioners are working on multiple things for our homeless situation, but that should not be happening in this community. Talk about that. And then I have someone interested in Karen's position, so hopefully we'll get that.
You have access to the link, or should we send it to you? So I wanted to just say that I know I was being in a very internally almost selfish way earlier with this report, and that my general comment is that the cuts, if you even glance at those list of cuts, 106 pages, they definitely hit the most vulnerable people. And we're aware of that. We in public health will continue to try to be vigilant about what that means in our community, how we can help. We're not alone in that, but I wanted to add that because I realize it's this kind of selfish as, oh, we're losing this much. Well, we're losing, like many agencies, we're losing the ability to serve as many critical people in early preventive ways, and so it'd be more appropriate to say that. And then this morning, I don't know if Jean or Julie want to just mention that we had quite a good conference, or I found it an intriguing conference this morning.
I think it was a continuation of the Invest Health sessions you had last night, and then
What was the conference, I'm sorry?
the Invest Health
Okay.
public
Robert
conference
Johnson.
today.
Okay.
And we had a keynote speaker who came in and told us about the past. It's Robert J.
Robert
right?
Wood Johnson.
Robert Wood Johnson.
Robert Wood Johnson.
RWJ.
Foundation, and the winners from last year and the ideals that those cities upheld and the goals that they were pursuing, and in the hopes that we could learn something from them. And then they tried to help us narrow down what our goals were for health in our community and highlighting what we were doing well, and maybe we could get together and figure out what we need to continue to do to close those gaps. And then there were breakout sessions on the individual topics. I think the housing one was the most well-attended because that seems to be the biggest need right now. But there were also breakout sessions for transportation, healthy food, recreation.
Urban forestry.
Urban forestry, I was trying to remember what the other ones were. So that was this morning, and although it was a very cursory topical survey of all the deep work that gets done, it was so really interesting and energetic crowd. It was better attended than I thought it was going to be.
It was
so.
very well attended.
And early childhood came up.
Good.
Yeah.
If we take care of kids from the time they're little,
We brought
they'll get a
this up
house.
in the housing
Well,
committee.
I mean, I didn't bring up the ACEs particularly, but when we were talking at the fire, when I talk about the library repairs work, if there's smoke in our community, where can somebody with not a lot of money and can't afford a HEPA filter go? Where can you take a kid that will not put them in
Bad situation.
a bad situation and won't keep them in a crib or whatever? It's like, so take them to the library. So figure out how we can do that so kids don't get asthma.
Luckily, the Children's Museum will move there.
Yeah, luckily, we're building a new library, maybe it can be fitted with.
But
the
people
brand
voted
new-
against it because there were concerns about funding, et cetera, and I understand that, but in my mind, pretty much everything keeps coming back to the public health issue. People live in Missoula, Montana because we really like it here and because we take care of each other, even people we don't like, even people we have differences of opinions a bit with about politics or art or whatever. And that means that we're gonna have smoke, so what are we gonna do about it?
Well, and that's one of the things the mayor mentioned a little this morning is it costs money to have quality of life,
Right.
Yeah, it's not free,
so
costs more not to.
that's true. Yeah, so it was a good conference, I thought. It was interesting to hear from the neighborhoods, the neighborhood, what do they call them, councils? Neighborhood councils. There were a couple of representatives just talking about how, they don't have pavement on a street, they don't have a sidewalk, so it gets dusty, but in order to pave the street, you're gonna have to take a bunch of people's yards in order to have the sidewalks too,
Right.
And then charge them for the payment.
and then charge. So, anyway, but
Competing
we'll keep going,
goals.
we'll figure it out.
Let me do this so I can
All right.
speak out about.
Thanks. So with that, we'll conclude and adjourn as the Board of Health and convene as the Air Pollution Control Board. And Deb, feel free to, I know you're on a tight schedule, so feel free to
I
take
move to
that.
accept the minutes as presented.
All right. We have a motion on the floor to accept the October 19 Air Pollution Control Board minutes. Any public comments on that motion? Any board or staff comments or discussion on the motion or the minutes? All approved, say aye.
Aye.
So moved. With that, we would move on to the Air Quality Advisory Council update, but I don't see anybody here to. There we go, Ben's here. Ben, you're just in time to give us an update.
All right.
Thank you, Sandy.
Drive safe.
Yeah, be careful,
Yeah, so, thanks, Ben. So we're up for item number 2, Air Quality Advisory Council update.
Okay, I was there for Saratoga last week. There was one agenda item that they considered, and that was the dust abatement program. That's where they put magnesium chloride down on county roads. The road department, though, insists on not calling it dust abatement. They call it a maintenance program. To them, it's very important to them. I'm not quite, well, actually, you know why. To them, it is maintenance.
It holds the road together, that's why.
Right, you put the magnesium chloride down, you don't have to grade as often. A good example was this last year, they did not do Dayshaw Lane. They had to grade that 3 or 4 different times. So anyway, there was a discussion that ensued, and in that, Eric from the road department was there, agreed to try to look at a cost comparison between grading and applying magnesium chloride. And I know budgets are fine, you get paid for something from this part of a budget, but you can't use it for this, and so that gets a little complicated. But there is some validity he felt in looking at, does it actually save them money to put down magnesium chloride potentially? And of course, the public likes it because the roads don't wash quite as fast, and it really reduced dust on, especially some heavy use roads, like the one we mentioned just earlier. So what the Air Quality Advisory Council wants to do is that by their next meeting is put together a letter to present to the air board here, and in that request that you petition or ask the county commissioners to reinstate the dust mitigation or road maintenance budget for applying magnesium chloride at least on 30 miles of road, possibly more. They're still writing their letter, and then they'll bring that here at that time when they're ready. And then that was their only agenda item they got to. They were going to do some work on wood stoves, but they decided to wait till Beth Berlin could be there at their next meeting since she had some opinions that really wanted to be involved in that discussion.
All right. Well, thanks, Ben.
Okay.
Guess with that, we'll move on to item number 3, public comments and items not on the agenda. With that, we'll move on to board or staff comments and items not on the agenda. I guess let's bring up, Jean and Ellen and I were at a meeting yesterday that was sponsored by the county commissioners, right? With the, basically, it was held out at the fire lab. I don't know, just maybe the 3 of us could chime in a little bit about what the takeaways were from that meeting. One of the takeaways that I took is that they, one of the presentations was, I believe it was a scientist, Mark, I forget Mark's last name.
I do too.
Finny.
Finny, yeah.
Right.
Oh, yeah.
Mark Finley, with the fire lab, gave a discussion on kind of the science of natural fire on the landscape. And one of the takeaways, he basically did a historical analysis of the frequency of fires on the landscape and the number of acres burned by those fires. One of the takeaways, he had a map. He just pulled up kind of an arbitrary box of, I'll call it the greater Missoula area. And I think it went up to, that box, square box went up to what, around Tucson?
Yeah, Houston, Evero, Clinton, Lolo, kind of.
Yeah, exactly. Didn't go all the way out to Sealy Lake. Went to the south, it went just south of Lolo. To the north, it would have gone just north of Houston, maybe not quite to Alberton. But in that box, historically, the number of acres that would burn every year on an average year was about 36,000 acres within that box. Would be a normal acreage burned every year with natural fires. And that's what we've suppressed over all these years. So even with the big mega fires that we're currently having, we're still not burning as many acres on a typical year as what would typically be burned. And in order to, of course, restore a healthy natural landscape, somehow, some way, basically saying we need to get back to that. You can't replace. And then he presented some other science how you can't replace the benefits on the land, to the land, with mechanical treatments. That fire has to be an aspect of it.
Because of the
Duff.
Yeah, the understory.
The understory.
So logging doesn't equal burning?
No,
Logging.
That's part of it.
Logging,
Yeah.
No, if you log, you're pulling out some of the big fuels, or a lot of the big fuels, but you have to burn in addition to logging.
You gotta
Okay.
burn the duff, basically.
If you don't, you're still gonna be subject to the mega fires. When a fire does come through, the timber that is there doesn't survive. The fires come in so hot, there's ladder fuels that then get up and burn like a thinned area. A logged and thinned area will literally lose pretty much all of its timber in a fire, whereas if fire has been introduced as a treatment to
There's
that
no
logged.
understory, then it can.
Runs
yeah.
through.
And it has to be logged, and it has to be
Goes too
burned.
fast and doesn't climb.
And the burning has to happen about once every 10 to 15 years. You can't just do it once, and if you get behind in your burning, then you're permanently behind. In other words, if you wait for 20 or 30 years to do your burn, you're not gonna catch up, because then the understory and the ladder fuels have grown and developed to a degree that now you can't burn it, because if you do burn it, it's gonna burn too hot, it's gonna crown, it's gonna kill all the trees.
Right, so you have to do mechanical before you can burn, when you let it get that far.
You have to do mechanical before you burn, and you have to burn afterwards, and you have to reburn once every 10 to 15 years, otherwise you're gonna lose all the benefit of your thing and all the benefit.
So what you're saying is we need 3 times the fire budget that we have now, just to catch up.
Well, we want it to be preventative budget, not
Right,
reactive.
that's what I'm saying,
Yeah.
like, just to catch up and get to a healthy place.
We need a lot more
But we
burning.
really talked about, I'm gonna call them the competing goals that the whole group has. So it's not just that I have a competing goal with the guy who's gonna do the burning. I mean, I do, he's got one with me, basically what we represent on our job. We have competing goals within our own agency, right? I mean, clearly, we're trying to get some people to think more about the fact that their kids are breathing smoke, and what do you do? So I'm, at the same time, how do we, and how do we accommodate the guys that are, and the folks that are trying to do that kind of burning? How do
Sure,
we
but-
do that?
Yeah, but controlled burning a little bit at a time, air quality is manageable rather than
It's,
just
yeah,
a
timing.
concentrated, just doing a little bit all the
Yeah.
time. I saw some fires up on,
I did too, up above the mansion the other day, or kind of
just
that
all
way.
these little spots, I'm assuming they're burning flash piles.
And we have, I mean, so the tricky side is we don't just have to deal with, do we burn a window, how much burning is preventive and how much isn't, and all of that, that's one thing. We have to think of it in this airshed, which has, unfortunately, not just a history with the topography, but we have a bad but improving history on the regulatory front, because we've been designated non-compliant, but not for PM 2.5. So, how do we,
And we don't ever want to be.
and we don't ever want to be, and we're basically tied with the standard right now, so how do we do that? And Sarah, we have, I heard from, not just from myself, but from others, we have a very sophisticated smoke management system.
Yep.
But boy, it's a good thing we do,
Sure.
because the narrow windows for burning
Forecasting.
have to be taken advantage of, and that involves moving a lot of heavy equipment, people, hoses, you name it.
Forecasting the weather.
It's like, it's one thing if your picnic gets rained out, but if your prescribed burn gets either rained out or closed down because of
Modified,
smoke,
yeah.
right, that's a lot of money.
Or because
So-
of a high-pressure system.
So it was, I thought, an intriguing and excellent way to start the discussion in a more pragmatic and local
Yeah.
way.
That panel that they had on campus about the fire, both
Right.
Sarah and Mr. Finney were
Finney.
there, and it was really well.
It's
And
fascinating.
then
Yeah.
that's online if you want to listen to all of that again. But the whole premise is, I mean, God, I feel old. Everything is multifactorial, huh? Like, it's not just, you can't just say, oh, we have fires, we need to do
Yeah.
X, and
Well,
that's
that
gonna
would be
work.
hard enough, but this airshed puts a
Yeah.
whole other twist on
We
it.
could just make the mountains lay down once in a while, Just go down for a little bit.
I know.
So I really appreciate that you folks took the time to come there, because I think it was well, it always just makes me proud of Missoula, because we have people that want to come together and find solutions. And so, we had wildlife folks there, we had land managers there that have a lot of land to manage and not a lot of dollars, and we had health folks there, we had the commissioners there. And, everybody was looking for, wow, what can we do a little different? And what I enjoyed was that I was watching people during the breaks talking to each other that don't normally interact. And so, I heard DNRC say to the Forest Service, boy, we ought to plan this and that together better. And so, that was just the first step. There's education piece, because we talked about the social capital that you can lose if,
If
a
you
fire
smoke
gets
out in
away
that
from you,
neighborhood.
yeah, or
Yeah.
especially some neighborhoods. I think the Marshall project up here in the Rattlesnake was a prime example about how the community really got involved, and in the end, they had to burn, what did they say? They burned 12,000 small hand piles this summer, and they'll have as many to do next summer. But because they made them small, they can burn hot, they can burn quick, so you can,
And they got them
don't have to
done.
worry about it.
Remember when we first heard here, oh, they're never gonna,
Mhm.
not never, but they're not gonna get those done.
Maybe that's what they're doing up,
They got
because I
them
saw way more
Those are
on
small.
Blue Mountain too. We
Oh,
saw
yeah.
all along that same
they're
altitude.
small.
But that's expensive for them.
It is.
It's expensive for them to burn small, but to get away from nighttime inversions or, those types of things, that's part of what they need to do.
if they fly over with a helicopter, and light,
Yeah, I know.
in a place that
Yeah.
doesn't have too much fuel. It doesn't cost them very much an acre to do it. When they have to do these small
They have
hand
to do
piles,
this
it's
by
very
hand,
expensive.
You know, something on the order of, when they could do it aerially for larger acreages,
300
they're
an
down to
acre.
like $30 an acre. And I think these hand pile burnings were like, it was more than an order of magnitude, it was
Oh,
like
yeah.
about $1,000 an acre.
There's a lot. So anyway, the conversation will continue. We talked about using the community wildfire protection plan, which the county is working on right now to update, and using that as a, kind of a stepping off point to help with some more community education, including the city council. Because, you know, it's not something that you have to adopt, but it's something you should be aware of, so using all those things together. And, you know, there was a few things that could have some, might need some legislation or some guidance that we think might be the opportune time to do, like apparently the Bureau of Land Management is in the Department of Interior, the Forest Service is in the Department of Ag. They both have a NEPA process, but they can't sign off on each other's process, so that if there was 10 acres of Forest Service land next to the BLM land and it all made sense to be part of one project, they can't do it together. So, you know, it's just silly things like that that there's got to be a solution for, so we'll keep working at it. But thank you guys for coming.
Oh, thanks for having it set up the way it was set up.
Yeah, it's
It was a good start.
a big issue that Missoula's gonna be.
And Mr.
facing.
Chesson came too from the Air Quality Advisory
Yeah.
Council, so that was nice.
Next time we have one, let me know.
The room got full. We had to
Yeah,
back
They
up.
started
Yeah, I don't think
disinviting
we even, I was gonna say, I don't think we even knew about it, but.
No. This was kind of our
It's
first
awfully
step.
interesting, though. Yeah.
Right. We want to make it a bigger tent for sure.
All right, any other border staff comments and items not on the agenda? Julie?
Just wondering in general, do we have kind of a target sense now when we'll try to say yes or no to the December meeting issue? So that I can,
I'm pretty much sure, I think just from what we heard today, I think we almost have a no.
I think it's kind of a no. Since we don't really have any urgent items, I don't see any reason why not.
Yeah.
Because I don't think we got August off. Did we?
No, we didn't. No,
We didn't get one off.
No, and we had that extra, you know, fast meeting that we had to do on, I forget what it
Yeah.
was, the rules, I
Or the
think.
fun, and we did the phone ones.
Mhm. So, yeah, so Merry Christmas.
All right.
All right, any other border staff comments and items not on the agenda?
Well, it would be fun though to figure out a time to just do
Yeah.
something social with
Yeah.
Karen and Teresa as they go.
Yeah.
We could even do it when you have your new appointees.
Hmm.
That'd be cool.
Yeah.
You know, I'm not a social person, so I'll rely on you to help me with that, okay?
Me either, I'll have some.
I just go eat the cookies. Yeah.
Oh, all right.
Okay.
Okay, well, with that, we'll adjourn as the Air Pollution Control Board.
Thank you.